So we're going to look at myocardial infarctions, otherwise known as heart attacks, and how they're caused and what they are and how to treat them. So let's take a look here. So here's our scenario. Let's say we have a middle-aged male with chest pressure or squeezing in the chest, shortness of breath, left arm ache, jaw pain. Okay, those are the signs and symptoms. Past medical history includes hypertension, hyperlipidemia, and a smoker. So hypertension is high blood pressure and hyperlipidemia is high cholesterol. All right, so let's take a look here at the heart. There are different regions of the heart, and each of these regions of the heart is supplied a good oxygen-rich and nutrient-rich blood supply by the coronary arteries. Those are the arteries we see there in red. So, for instance, this artery here feeds the whole green region. This artery here feeds the whole blue region. This artery here feeds the purple region. Okay? And those are the coronary arteries. And these regions can be described as anterior, septal, inferior and right ventricular, and lateral. So each of these coronary arteries has a name. Like, for example, the right coronary artery, left anterior descending, and circumflex. And each of these arteries feeds a certain region of the heart with nutrients, so the heart muscle can continue to pump effectively. Well, if we want to see what's going on inside the heart, one of the things that we can do is we can do an ECG or an EKG. And what an ECG or EKG is, it's the same thing. It takes a look at the electrical activity moving through the heart muscle because it's an electrical muscle. There are ions, cations, anions going in and out of cells causing the muscles to contract. Well, we can see that flow of ions on an EKG. So basically, we're taking a look at the heart from 12 different angles. Okay, so here we have a typical EKG, and we can see there's an angle here, lead 1, lead 2, lead 3, AVR, AVL, AVF, views V1, V2, V3, V4, V5, and V6 for a total of 12 different views of the heart. Okay, so the cool thing is that each of those regions, each of those views is of a particular region of the heart. So, for example, these 6 views here, V1, 2, 3, 4, 5, 6, are of the anterior portion of the heart, or in this diagram, the blue portion of the heart. And we know that that portion of the heart is fed by the left anterior descending coronary artery. So therefore, we can map it out easily. We can see that if there's going to be a problem with the right coronary artery, it's going to show up in these 3 views here. If there's a problem with the circumflex artery, it's going to show up in these 2 views here. And lastly, if there's a problem with the left anterior descending, the LAD, we're going to see it in several of those views there. Okay, now when we say problems, in this case, we're talking about heart attacks. And what a heart attack is, it's when there's a plaque buildup or some sort of occlusion, let's say here, blocking any distal circulation for the left anterior descending. Okay, or it could be here, blocking any distal circulation for the circumflex artery. Okay, now it goes to reason that the higher up the occlusion, meaning if it's proximal here, none of this region is going to be getting a blood supply. So therefore, it's more of a serious heart attack or infarction. Okay, so here's a normal 12 lead EKG. The bottom strip here is lead 2, several seconds of lead 2. Okay, so we're looking at these 12 views here. That's normal. Here are 12 views of an abnormal EKG. normal, abnormal. See if you can spot the difference. If you're having trouble, I highlighted views V1, 2, 3, and 4 on this one, and views V1, 2, 3, and 4 on this one. We can see there's a problem with leads 1, 2, 3, and 4 on this EKG. Well, that maps out right here. 1, 2, 3, and 4. That maps out to be the left anterior descending coronary artery. So here is our problem. We have some sort of occlusion somewhere in the LAD, most probably. So how do we treat that emergently? Well, there are a couple things that we can do that can make a huge difference in this patient's care. Number one is we need to give this patient some oxygen. Because of the blockage is not letting oxygenated blood past that blockage, we need to increase the amount of oxygen this patient is getting. Secondly, unless contraindicated, so unless the patient is hypersensitive to aspirin, we're going to give 324 milligrams of aspirin, which may help thin out the blood a little bit. So there's a possibility we might be able to get a little bit more blood flow through that clot. But here's where the patient needs to be: the cardiac catheterization lab for angiography and for potentially balloon angioplasty. And if that doesn't work, the patient may need open heart surgery.